Thank you. Thank you for having me this evening. It's a pleasure to be able to chat with you today about all things COVID.
Yes, yes. Which is like topic of discussion for today. Because there's so much going on in the community. I
Mhm.
thought that it would be a helpful and interesting topic to talk about, especially amongst our community. So, when we look at COVID and the stigma associated with COVID-19, there seems to be a negative association between the different community groups of people in our community with with the outbreak. And now with the Delta variant on the rise, people have been
Mhm.
displaying different views and their opinions associated to, what's acceptable and what they perceive that should be acceptable, such as their views on receiving the vaccine versus the people who do not have the vaccine. Also, the people who wear masks and around different environments, such as school and work, and then the people who don't wear masks. You get people
Mhm.
that look at you differently everywhere, even in a grocery store. So it's like, there's a divide amongst the people in the community, when you go out, do you vax? Do you not vax? Is the question. And moving forward, we want to use this space to educate everyone. So, with the first question, Japari, why is COVID-19 causing such a huge stigma in the community, and how can we address that?
Well, so it's 2020, and there is always going to be something that causes stigma, or at least some kind of, I almost want to say polarization. But you can look at stigma from various angles. You can say there's the stigma of individuals that come from a certain part of the world that has been associated with COVID-19. There's also the stigma for people that have the disease or have had the disease and potentially might have exposed their coworkers or their family members to the disease. But I think with regards to the Great Divide, we seem to be on like a black or white type of trajectory in life. It's either A or it's B, and you're either like very much pro-vaccine or you're very much against vaccine, and almost even thrown into a group of anti-vaxxers, which is a whole different thing. Anti-vaxxers are not, that's a different entity of itself. But um, looking at the way society is right now, we want to just automatically categorize people and tribalize ourselves, him versus her, she, against each other. One of the examples I can give you, so at my job, I work two jobs. We nurses, we're hustlers. We always have a side hustle somewhere, but my side hustle is at a local hospital. And at that team, I pretty much feel like I have to code switch because when I'm working with a certain group of my coworkers, they're like not for the vaccine. They are in the whole conspiracy world. They've gone down Allison's rabbit hole and
Oh,
they are not for it. So I sit down there quietly eating my little sandwich and pretending not to pay attention to what they're talking about. And then 2 nights later, I might have a group of coworkers where we're all vaccinated and we're all talking and high-fiving ourselves because we're all vaccinated.
mhm.
And then somebody else in the group might just be sitting down quietly eating their sandwich pulled away. And I think for a fact that's majority of how our conversations and relationships go, which shouldn't be the case right now. I think stigma comes from mainly fear and anxiety. That's the bottom line. People, I want to believe, are doing things for the best with the best things that they have, with the information that they have. They're trying to make the best decisions, even if it's a decision that I may not fully understand, or really even agree with. So just, reminding ourselves that we need to be mindful of the people that we're around, being careful with the words that we say that may hurt another person, that may come off as negative and push someone even further away from the middle, because really we're not black and white creatures. We're really not. We're all colors of people. And humans, we know, don't change because of the facts or even because of education. And I'm a nurse educator. I can educate and educate and educate, but that's not what's really going to change a person. I think what changes people and what connects with people is our humanness, our ability to empathize and to be kind. So trying not to tribalize things, trying not to make things be all black and white against or for, and try to find, common grounds with other people. Like my favorite is we're all just trying to do better for our loved ones. So that's my spiel.
Right. Okay. So with all of the information out there about COVID-19 and now with this new Delta variant, how can we get more educated about it so that we can be in the know? And what can we do to improve the stigma in the community?
So with regards to getting educated about it, you can always call up your favorite nurse. Hi. Or I always say talk to your friends and family members who have had close experience or relationships with what's going on with the pandemic. For example, if you know someone that's a nurse or a doctor or a healthcare worker, talk to them. Ask them what they're seeing, what they're experiencing. If you know someone that's been affected by COVID, talk to them. Ask them what happened. What were your thoughts? Would you do something different? Try to gather as much information and try to come unbiased. We all have our biases. That's a fact. But recognizing that you do have your bias and appreciating that, but going into every situation with a curious mind. For example, if you are looking for information on the internet, maybe, try to find information that is reviewed by the experts or people that are versed and well-rounded and understanding of the situation, as opposed to things that might be polarizing, that might just have that little extra spice to it to get you a little bit upset. Right. Just be wary of those kinds of sources, is what I always encourage people to do. And then also, in terms of information on stigma, I just say stay in tune with what's going on around your environment, around your city, around your neighborhood. If you're someone that has kids that goes to school, for example, find out what's the school doing about their mask mandates. Why are they doing that? What are the teachers thinking? Just being curious and open-minded about it all.
Yeah, I mean, it's a lot, and it's so many myths about, the virus. How do we stay on top of what's what? Like, what? I hear so many different myths. It's hard to keep up. Every day there's something different. You're seeing things on Facebook, Instagram, TikTok. It just, yeah. So, from your experience with nursing and working for the health department, what are some myths that you know about that are associated with the virus?
Well, yes, like you said, there is quite a lot. I would say one of the top myths is about COVID-19 altering your DNA. I'll put another myth, which is COVID-19 has a microchip in it. COVID-19 vaccines, which are both false. So, little bit of science here. With the COVID-19 vaccines, they don't have that ability. When you look at the vial, it's that liquid looking item in the vial, that's the vaccine of it in itself. And I just want to let people know, if you are worried and really worried about a microchip, burn your phone. I was talking to my husband yesterday. We saw a picture of a toaster on Amazon that was connected to Wi-Fi, and I'm like, and they're worried about microchips in the vaccine? No, that's what you should be worried about, the toaster. If you really truly were worried about microchips, it's too late. I hate to be the bearer of bad news, but they are already tracking you. They have you. They've been watching you. So there are no microchips. These are vaccines they're actually considered clean vaccines. They have very simple ingredients in them. These are solutions that we use for regular medications, saline solution, which includes salts and sugars. And then the main active ingredient, the one and only active ingredient in the vaccines themselves is the mRNA, which I know a lot of people are like, well, that's DNA. No, it's not the same at all. mRNA is like a message that your cells use to communicate with each other.
Yeah.
So a simple way that I try to explain it to people is think of your favorite recipe, like something you like to make. As a Nigerian, I'm going to throw out there that Nigerian jollof rice is better than Ghanaian jollof rice. Sorry for anyone that might be Ghanaian and might be offended by that, but it's a fact. Anyways, I wanted to say that Nigerian jollof rice, to get the actual delicious meal of itself, I would write down the recipe for you. I would say, Kathy, get 10 tomatoes, get habanero peppers, get some flake peppers. I'd write every single thing down and I'd hand it to you. And you would read that instruction and you'd basically do whatever that instruction tells you to do. And voila, you will come with a Nigerian jollof rice that is just amazing and better than Ghanaian jollof rice. Anyways, that's what mRNA is. It's an instruction that tells a couple of your cells how to make spike protein. That spiky thing that is sticking out of the coronavirus that we've seen all over the internet, all over our phones and websites. And that spike protein is what the virus uses to latch on and hold on to your good and healthy cells and enter the cells and start making more coronavirus cells from there. So what we're doing is teaching the cells how to prevent that entrance, that spike protein from latching on. So that's my spiel about mRNA and how it is not DNA. It's just a message.
No
microchips. No microchips either. The microchips are in your phones, okay? If you're looking for, go burn your phone now. But yeah, no microchips in those. And actually, that rumor, I think where the rumor stemmed from was with Bill Gates, because everything stems from Bill Gates, the Bill Gates Melinda Foundation. So originally, Bill Gates is a philanthropist, and he had, I believe, suggested an idea that was related to refugee children and how to be able to collect their vaccination records in one simple way. And out of that, there might have been talks about having some recording system that might be chipped to the child. I really don't know. But my understanding is that the microchip situation evolved from Bill Gates suggesting that we need to keep track of children that are from countries that, displaced people, so that we could be able to keep records of their vaccines. Sorry, that was a long story about jollof rice and microchips. My bad.
That's okay, because we need all of this information. We need to learn how to disseminate between factual and not true information, unfactual information, because I think that in our community, the information that is false is overriding the factual information. And to a point where, a lot of people are dying at higher rates, and is unfortunately is sad. And in the Black community, we are the last. We are always the last to be informed or to seek information.
Right.
Unfortunately. But with technology and having everything at our fingertips to get these resources, from your experience and also working on the team to provide these services, what is the most accurate way to sign up to get vaccinated?
So they've made these vaccines available at the easiest, methods possible. I always suggest going to Michigan's website, michigan.gov. So it's michigan.gov/coronavirus, and it has a wealth of resources. So places that you can get vaccinated, but as well places where you can get tested, because if you are exhibiting symptoms of COVID-19, it's very important that you get tested ASAP. This disease is unfortunate because it spreads faster than you can even imagine. You know, people that don't even show symptoms or might have a little sniffle, you know, they've already infected 5, 6 other people unknowingly.
Mhm.
But Michigan's website is for sure the best with regards to resources for people on where they can get the COVID-19 vaccine. Your local pharmacy as well. Talk to CVS, Walgreens, Rite Aid, but your provider might also carry it or suggest where you can get the vaccine at.
Okay, so what about women who are pregnant and that are thinking about getting a vaccine? Your recommendations?
So the recommendations that we got from the CDC is that pregnant women, as well as women that are planning on becoming pregnant, can go ahead and get the vaccine. During the trials of these COVID-19 studies, and over the millions of people, the hundreds, over 100 and some 60 million people have received COVID-19 vaccines. Trust, there's a lot of pregnant women in that group. We know there were lockdowns. But women have received the vaccines and are doing fine. The CDC, the HHS, Health and Human Services, they have a really rigorous vaccine surveillance system, which is called VAERS. It's called Vaccine Adverse Event Reporting System. And basically, it's a place where you can report any kind of adverse event, such as unfortunate miscarriage or, you know, changes in reproductive cycle and menstrual cycle. Things like that can be reported. They have not seen any trends. Oh, and I do want to mention that when it is reported, they do follow up to see and investigate more, make sure that if there's something that needs to be addressed and is more widespread, they make that known, such as with the Johnson & Johnson and the blood clots that was found. Very rare blood clots. I will let you know. My sister, she got Johnson & Johnson. She is fine,
Oh,
protected.
goodness.
My mom, my dad, my brother, they're all the J&J folks. But I was mentioning the vaccine adverse event reporting system, which is available for public to look at and see what people are reporting about their vaccines. But with a caution, I want to mention that it is pretty much like a Yelp review, if you would look at it that way. It's like a Google review of the vaccines, and people can just go online and basically say what they might have experienced, which might not be directly related to the vaccine or caused by the vaccine. So
Okay.
correlation does not mean causation.
Mm.
But it is rigorously monitored, and they do take those reports very seriously. If you are pregnant, you are possibly able to pass on those antibodies to your newborn child, to your infant, which will provide protection for them as well against this very scary, crazy disease.
Hmm. So, say I'm considering getting a vaccine, but I have had COVID before. Um,
Mhm.
would that cause anything to happen to me or any reaction from the vaccine?
Not really you might have a reaction, but think of it as a booster reaction. So when you possibly were exposed to COVID, you got some antibodies. You garnered yourself some antibodies at that time. Now we're still learning so much about the COVID-19, the natural infection, the vaccine immunity, and things like that. So it is possible that those antibody cells that you got at the 5, 6 months when you were sick with the disease might have weaned off. Getting a vaccine is like a booster shot. See, we get vaccines like Tdap every 10 years or so because we need that booster to get our system to remember, this is what this disease could look like. Get some antibodies again, recruit the antibodies. And so that's basically what you're doing. You're giving yourself the best chance against this disease. Might you have some reaction? Maybe, just because your body remembered what the disease looked like. So it might give you a little bit of some fever, and that's just your immune system responding to that foreign thing that it's about to attack. But as soon as it realizes it is just a vaccine and unable to make copies of itself, it's like, oh, okay, I'm good. I'll just make some antibodies and wait till the real guy comes around.
Okay. Now, what are some reactions, the normal, I guess, reactions that happen to people who receive the vaccine, the first and second dose?
So everyone's different, you know. You hear about people that were out for days. My coworker was like, I was out, I couldn't breathe, I couldn't. And then you hear other people, they're like, I didn't even feel a thing. I was fine. So a person's reaction is just it does not it's not the staple reaction, but typical things we've seen is that you might have some nausea, you might have some like some vomiting at the most because your body is trying to expel some corrupt cells or fight back. A little bit of fever as well to burn up the agent, to destroy it. You might have some headaches. That's your body's, response as to stress. Also even pain at the injection site. I mean, it's a little needle, but it is a needle and it's going into that area. So it might be sore, but these are all signs that your body is fighting back, which is good. So having a reaction is actually like, oh, okay, well, this works. The machine works. And not having a reaction doesn't mean that it didn't work, but it just means that you might, your body might just have a more stealth way of fighting diseases off. And again, it varies. You might be at a stressful stage in your life right now. I was moving the last couple of weeks. If I took a shot, it would have put me out, out. I would not have, I would have just been out. But I always say, plan it at a time where you can get some rest. Take water. Water is your friend. Stay hydrated. Get an ice pack if you need to put it on your arm. Take some Tylenol if you start to have a small fever. But those are not abnormal things.
Okay. I don't see any questions yet, you all. Thank you all for joining the conversation. If you have questions, please submit your questions in the comments box below. We want to know your thoughts if you have any questions. All right. Now, I did hear something where I think it was something that I was reading, and a lot of people, they wait until they get sick to want the vaccine. Is that possible to get the vaccine once you have COVID?
No, unfortunately, the vaccines don't work that way. So vaccines are our tool with public health, which is preventative health. Primary health, which is to prevent the disease in the first place. This falls in the categories of screenings, taking vitamins and trying to be living a healthier life, exercising. That's all prevention. Vaccines don't work when a person is, either severely ill or hospitalized, because at that point it's too late. You have to focus on other treatments. And the doctors and the scientists, they're doing a lot better in taking care of people who are severely ill. We're not having as many people succumb to this disease as we did last year in March. But the vaccine is to help prevent you from getting to that point. It takes about 2 weeks for antibodies to build up. That's why they say you're not fully protected until 2 weeks after your Johnson & Johnson dose or your 2 Pfizer Moderna doses. Oh, right. So that's why you need to really think in advance to prevent yourself from being in a situation where they're now at limited options, to intubate, to not intubate. I'm hearing of crazy things happening in my old home state, which was Missouri, where they have a huge surge going on. And my colleagues, and I tell you, these nurses are my ride or dies. They're going through some crazy stuff. One of my colleagues had posted a thing about having to decide who they were going to keep in a bed because they were running out of space. They were running out of beds. They are out of beds at this point. They're out of beds. And so we nurses, we have our regular patients. We have our chronic disease patients that we have to continue to take care of. But now we're getting these patients with preventable diseases like COVID. And it's sad. It's really sad that you have to make those decisions. I don't envy any of them in this position, in those positions at all. I really don't. It gives me chills to think about what some of them are going through right now.
Yeah, it's really unfortunate when it gets to that part. It's sad. But moving forward with further educating ourselves staying informed about this virus, can you provide any tips or resourceful information that will help us to continue to stay safe, whether we are
Absolutely.
vaccinated or not vaccinated?
Absolutely. Well, first of all, I always want to say people keep an open mind. Don't shut yourself down. We started the conversation talking about different tribes, and the reality is we are one tribe. We are one group of people just trying to continue life and get over this hump, which is this pandemic. Is it a way that you might not agree with somebody? Possibly. Um, don't alienate people. Have conversations with people. Encourage people to do their own research and make decisions for, the whole picture. Make informed decisions. And sorry, side note, when you give a patient like a consent form regarding what the procedure is going to be, whether it's like, an amputation or even a simple thing like, you know, the EEG, like going down their throat to see how their belly looks. You have to inform them about the risks and the benefits and everything. Do that. Do that for the vaccine. Look at all the resources. Be mindful of sites that, like I said, elicit your emotions because those are sites that probably have, ulterior motives involved in them. Always look for credible resources. Talk to your family members that are in the healthcare field. Talk to your friends that are also in healthcare or even have experienced COVID. And then if you choose not to vaccinate yourself, remember that you do still have to have a plan. We
Yeah.
are fighting an enemy that is not visible, as my coworker says. You still have to have a plan of action. So you gotta still wear your mask. Wear a mask that is going to protect you as best as it can. Research what masks are good. You can wear a cloth mask, but hey, you might need to double up with a surgical mask on that. And then, of course, eat healthy. Try to exercise. Try to stay healthy because at the end of the day, that's your whole body. That's your future. And you got to invest in that as well. Finally, if you ever have questions or need a nurse to talk to, I mean, and I don't want to put this spiel out there, but we are a team of nurses that actually answer people's calls all day long when they call about COVID-19 and their situations, very peculiar situations. And we'll talk to people about it. But remember that this is a disease that it affects you as a person, but it affects other people as well. And we got to think about other people who might not have the same outcome that we might have. So that's all I got.
Oh, wonderful. Thank you for sharing all the details and information from your field of work, your expertise, um, everything. I truly appreciate you for coming on, Japari. Thank you so much. Thank you. Thank you, community. As always, feel free to follow the podcast. Feel free to catch up on episodes. Minding My Black Owned Business, Women in Business podcast, available on all podcast platforms near you. Japari, at this time, do you have anything you want to share with the community? Any online educational classes for COVID or anything that can help further?
Well, yeah, I always say if you're interested, the WHO, the World Health Organization, has little courses that people can always take to improve their, get get more wealth of information. But also, if you are interested, visit the Michigan Department website because there's more resources. 211 is their helpline if you ever need resources. Also, mental health. And I'm thinking that's going to be a conversation that will happen in the future, in the near future. And then lastly, shout out to my sister for always supporting and being my biggest fan. And then also to my coworkers out there that I love and share this world and life with right now.
Awesome.
Thank you for having me, Kathy.
Beautiful. Thank you, everyone, for tuning in. Have a wonderful night. Bye.
Bye.